Hello all, myself Saranya, Assistant Professor from SNS College of Allied Health Science. Today we are going to see about cardiomyopathy. It is a very interesting topic which comes under pathology. So what is cardiomyopathy? Cardiomyopathy is a group of disease which is affecting the heart muscles, which leading to a mechanical and electrical dysfunction, which often resulting in heart failure and arrhythmias. This can be a genetic as a major reason, and also due to secondary reasons of systemic autoimmune disorders can also be the fact. So what is actually happening is, in cardio is a heart, okay, myo means is a muscle, pathy is a disease which is affecting the muscle. So what disease is happening in the heart is, you can see in this image as a normal heart has been given, and you can see the left ventricle has been lightly bigger, which is called as dilated, and on the other image you can see the muscular portion of the heart has been dilated, which is called as hypertrophic heart. And in another part it is a restrictive, that means the left ventricle will not help for a pumping, it becomes very stiff. So think how it can pump the blood to the other organs if it is a problem in left ventricle itself. It is very difficult. So what are the various classifications that we have seen on the image already? It is dilated cardiomyopathy, hypertrophic cardiomyopathy, restrictive cardiomyopathy, arrhythmogenic right ventricular cardiomyopathy, and other types like TUSCO and the peripartum and unclassified. So what is actually happening here is, in dilated cardiomyopathy you can see an enlarged and weakening ventricles. It cannot able to pump the blood to the aorta. And another part is hypertrophic, where the muscular portion of the left ventricle as well as the right ventricle has been thickened out, so that the ventricular space becomes very less. So the blood filling phase and the cardiac cycle will also be getting affected. It cannot able to pump the blood to the aorta and the other organs. In restrictive form, it becomes very stiff. The ventricles are very stiff and impaired filling occurs. The arrhythmogenic right ventricular cardiomyopathy will have a replacement of myocardium with a fatty tissue. So this fatty tissue will not even help for pumping of the blood. And these are the other forms which depend upon the stress induced cardiomyopathy. So what is the pathophysiology behind it? So in type of these four types, you can see a dilation of the ventricle, and also you can see the stiffness of the ventricle. So what this actually does is, it both will reduce the contractility activity of the heart. The heart cannot able to contract and eject the blood out. This is what happening in hypertrophy also, where the cells become fibrosis, very hardening. And the myocardial stiffness will impair the diastolic filling also. Why? Because the left ventricle will not get filled properly in case of stiffness. And this also leads to an backward effect and the heart failure progressively. And in arrhythmic, you can see that the area will be having a fatty tissue growth. These are the things that can be happening on different forms of the diseases. In risk factors, what could be the risk factors of having this cardiomyopathy is, it is a genetic predisposition, the familial forms is a major reason, or a viral infection, alcohol and drug overdoses and toxins. And the systemic diseases, which is an autoimmune diseases like amyloidosis, sarcoidosis, hemochromatosis can also be the reason for the cardiomyopathy. And the nutritional deficiency and autoimmune disorders can also be the reason. So what could be the major clinical features and the symptoms that the patient will face when they have an cardiomyopathy is, first thing is, they will not have a blood supply to the brain. That is a major reason. Why? Because there is no cardiac output from the heart. So once this is happening, the patient will have a dyspnea, fatigue and palpitations, and this will be the main thing. And they will have a syncope. Once this is happening for a long duration, this leads to a heart failure also. And arrhythmias will be noted in every form of heart diseases. And finally, this can lead to sudden cardiac death also. So what is the management, or what is the diagnostic method we can go on with this is, first find out the history and the physical examination. So then see the ECG, where it have an arrhythmias or a conduction abnormalities, and see the size of the chambers through echocardiography and valvular thickness and the function of the valves and leakage of the valves and everything. And in cardiac MRI, you can see the tissue categorization, how the tissues has been developed or it has been obstructing to the blood flow. And endomyocardial biopsy is for the specific types of cancers regarding the heart. And the genetic test is very much important if there is no predisposing reasons for getting this cardiomyopathy. So what could be the complications that will occur is they can be in heart failure, arrhythmias, thromboembolism and the sudden cardiac death. You can see a ventricular arrhythmias and the atrial fibrillation note here. So what is the management throughout it is you can have one drug management, which is pharmacological management with the help of AC inhibitors, beta blockers, calcium channel blockers, diuretics and anticoagulants, whatever. It will be treating over the heart to get pumped out of blood. Okay, it will also enhances the cardiac output. That is what the major reason. And once there is a stagnant of blood in the ventricle, it may cause a clotting. It is a major thromboembolism is a major factor, so we are giving an anticoagulant. So what could be the norm for blood pharmacological treatment and the lifestyle management that we can go as self restriction, like with salt restriction, fluid management and exercises. You have to restrict something in your life to get well done. And device therapy, if they are having an arrhythmic manner, you can use an ICDs. And the surgical repair, if it is a hypertrophic or the ventricular septum is very large, we can do an septal myomectomy, that is removal of the part of the septum. It can be done. If the heart is totally dilated, there is no use of having anything. The final management is heart transplantation. So what could be the patient education that we are giving us? Monitor the symptoms, medical adherences and the genetic counseling is very much important. Thank you for listening. Hope you have understood this topic.